Our big news today, a government panel of health experts is trying to save the lives of people who smoke. They're recommending a low-dose CT scan might save your life.
That's the story we're going to talk about on the health front this morning. Also, this is getting a lot of attention. A 13-year-old girl in California, she dies after taking just one bite of a Rice Krispie treat.
And she even spit it out. Dr. Caudle, I mean, how could that happen? Let's talk about that in just a second, but I want to get back to this smoking thing. So many people in this country who still smoke. You got to put out those cigarettes.
Yes.
But how is this different just getting a CT scan? Didn't we already give them those scans?
Well, yes and no. So this is actually a big recommendation in my opinion. The U.S. Preventative Services Task Force is an organization made up of experts that help decide what screening tests we should be doing. They've recently come out and said that patients that are high risk for lung cancer, those are smokers with certain features, should be screened for lung cancer with a low-dose CAT scan. Now, to answer your question, Mike, no, we haven't had that recommendation before. This is something brand new and really could make a big difference.
When you talk about the difference, what is the difference in, say, treatment or, longevity if you're diagnosed?
Right. Well, let's first of all remember, let's talk about lung cancer first of all, okay? Lung cancer is the third most common cause of cancer in the United States, and it's the leading cause of cancer death in this country. Also remember that 90% of people who get lung cancer will actually die from this condition. Now, we have screening tests for other things, right? We've got mammograms to screen for breast cancer, we've got colonoscopies to screen for colon cancer, but we don't have anything to screen for lung cancer. And that's really the difference here, is that we might be able to save some lives.
And it happens fast, right? It spreads very quickly, doesn't it?
Lung cancer can be very deadly. As a family doctor, every year I see and have patients who are diagnosed with lung cancer, and it can be a very devastating diagnosis.
But people get lung cancer.
Severe.
People get lung cancer who haven't smoked at all. But here's what was the question I was going to ask you? Oh, would insurance pay for this?
Well, that's actually one of the things. This U.S. Preventative Services Task Force, if this recommendation actually goes to final approval, this is a draft recommendation. And let me be very clear about the recommendation first of all, okay? It's current and former smokers who are between the ages of 55 to mid to late 70s, those who smoked about the equivalent of 1 pack of cigarettes a day for 30 years, and those who have been smoking within the last 15 years. Those are the people that we're talking about screening for lung cancer. But the big thing here, Mike, is you mentioned a really great point. If this goes to final recommendation and is signed off as a final recommendation, yes, this really could lead to health insurance companies paying for this test because it would be an approved screen.
I don't know if I feel I'm going to turn into Rush Limbaugh all of a sudden here. Why should our tax dollars go to people who are smoking? Put out the cigarette.